So we're going to work on trying to move our shoulder blade and then hold it still while we try to push or pull or do something with our arm. So the first thing we're going to do is we're going to get our shoulder blade set. So we just got to get that shoulder blade back. And when I get that shoulder blade back, I just want to make sure it's not popping up, that it is going back and maybe even a little bit down, but I feel like it's nice and stable. I'm going to hold it there, and then I'm going to take and I'm going to give myself a little squeeze. Like if I have a dollar bill here between my armpit, somebody's trying to pull that dollar bill out, I'm going to give myself just that little bit of a squeeze. So step one is getting that shoulder blade back, a little bit down, and then step two is giving myself that little bit of squeeze. Step three is finding a pillow or some item, and you want it to where you're not having to lean over too far down to hit it. You want it in a nice neutral range, and as I get everything back and set, I'm just going to try to push down into that pillow a little bit. When I push down, if I push down too hard, what you find is I want to pop up and over, so I'm only pushing down just enough that I feel all the muscles that I've already engaged to get my shoulder blades set are kicking in more. And then I'm starting to feel a little bit of my deltoid, a little bit of my triceps back here, so that you can kind of see what I'm doing. I'm taking this shoulder blade in and going back and down just a little bit. I'm giving myself that little bit of an armpit squeeze, and then I'm pushing my arm down. And what I'm feeling is all these guys right through here getting tight, the back of my deltoid, and even into my triceps. So we'll do this again together. We're going to go hand on some sort of a soft item. Shoulder blade goes back a little bit down, a little dollar bill squeeze is what I call it. And then I'm going to take my hand and try to push this pillow down into the ground. If it bothers you to stand up and do this, you can also do this sitting in a chair with your back supported. You just want to make sure that you can get that shoulder blade set and then push down on some sort of item in a good position that feels good, and we're not having a lot of upper trap flare or any other symptoms in the arms or hands.